is Neva from Core Dynamics Physical Therapy in Englewood, New Jersey. I am going to do a few exercises with you guys now. Schedule is clearly not where it's been. I actually prefer to do my exercise in the morning, especially on Mondays right before work. But with our stay at home, stay local, and stay in our social distancing world right now because of the coronavirus, I brought some stuff from home, some stuff from the office to home. I grabbed an 8-pound weight, an extra mat, some resistive bands. You can't see, I do have a TRX and a chin-up bar that I won't be using right now, but I thought I would do a couple of moves for you guys. These are fun and not too difficult. Don't need much equipment. You can do no weights. You can use some of these weights with some things. So let's start off. We're going to do some bird dogs or opposite arm, opposite leg. You're going to place your arms straight under your shoulders. You want to look kind of straight ahead so your neck stays straight and your knees are straight under your hips. You're going to bring your right arm and left leg straight out. I can turn sideways for a minute so you can see. So the leg's going to be straight out. Okay? Let's get back to that. So let's go. We're going to hold it for 1, 2, 3. Bring it down and go for the other one. Hold 1, 2, 3. Good. Bring it down. Again. 1, 2, 3. Bring it down. Keep going. Go at your own pace. Count to 3. Make sure you're inhaling and exhaling, breathing, count out loud, and down. Try to get to up to 10 of these for each side, or 10 altogether maybe. Good. Keep it up. Good. These are great for stability. You're using your whole arm. You're going to press down through the mat on the arm that's down. You're lengthening through the other two, the arm and the leg. So it's good. You can keep your hips squared and steady. Honestly, I've lost count. So when you guys are doing it at home, just count to 10. Good. Last one on the right. And last one on the left arm, right leg. Okay, so while we're still on the mat, next exercise we're going to go into are some rows using our lats, which are a great muscle in our back. You can do this one of a couple of ways. If you want to do it, you can do it with no weight. Easiest way, all fours and just row. Okay, and keep that elbow very close to your body. So that's what it will look like. If you want to do kind of medium, pick a weight. Again, I only brought the 8-pound home, but that could be on the heavier side for many. And you would row same way. Okay. So it would look like that. Or hardest way, and you can have shoes on. I happen to not have shoes on, but we'll be in a plank position. Okay, so my legs are straight out. They're actually wider than they normally would be for a plank. And then I'm going to row. So something like that. Okay, you pick yours. I'm going to do the plank with the row. And let's get started. Let's try to get 8 rows for each side. If you need to come down onto your knees in between, that's totally fine. If you can switch right to the other side, go for it. Okay, so you're going to come up, really engage that arm, and start rowing. 1, 2, 3, 4, 5, 6, 7, 8. I'm going to pass it right through and go on to the other one. 1, 2, 3, 4, 5, 6, 7, 8. Awesome. So if you stayed all the way down, it would look like this again. If it was with the weights. If without the weights, it would look the same. You can also do the plank without any weights. You pick all those from all those versions. Awesome. Okay, so we're going to move into a standing sumo squat or wide squat. Again, I'm going to choose to do the weight, but let me put the weight down. You want to be pretty wide as the mat, maybe a little less. Feet are pointed out, and you're going to go down and come up. Come down as far as you can without getting your knees too forward, and then come on up, okay? You can go mini plies or mini sumo squats, or you can come all the way down, okay? So you can grab a weight, grab no weights. I'm gonna grab one weight, I'm gonna hold it down, and we're gonna go up and down. Let's go for 12. 2, 3, 4, 5. Pretend there's like a little chair behind you, but because it's wide, it's gonna look a little different than a regular squat. If anything doesn't feel right, make a little bit of a change to make it feel better. And if you have to, you just gotta skip. But do what's right for you. I do this every time I talk, and then I don't know how many I did. So if you got to 12, give it a break. If not, finish it. Good, I'm gonna do one more. Awesome. From that, I'm gonna do, I didn't have my kettlebell, but I'm gonna use this for a swing. I'm gonna do a single arm. Actually, bring my leg a little closer. So I'm gonna swing my arm using my legs, swing that through. Okay, let's go. So it's a little bit of a mini plie, but it's really through the back of your legs that you're swinging through, and the arm's kind of going for a ride with momentum. Good, and I'm gonna switch. So again, you could do this without any weight. You could do it with one weight, hold both hands, I'll show you that in a second. Or you can do a heavier weight or any weight with one arm. Different choices here. So it could look like this, where I'm just tossing this, right? I did a bunch. Again, you could be single, or double, or just no weight, just swing. So a few different choices depending on your level. Awesome. Okay, so next we're gonna go into some bridge exercises. I will make a little disclaimer. If you're dealing with chronic pelvic pain, I do have some patient types that do not do well with a bridge. So just be mindful if you're feeling anything that's, again, not comfortable for you, just make a change. And of course, you're always welcome to skip an exercise. I'm just putting together just a few exercises for you guys to have fun with and be a little bit more flexible for all populations. Okay, so we're gonna lie on our back. Head's gonna be down. I'm gonna look at the camera for a minute so you guys can see me, but pretty straight. So you could just do a general bridge where you can come on up and hold for a second and come back down. So you could do that. You can come up and hold longer, maybe for 10 seconds, and then come down. Or you can come up and march, and then come down. So again, choose either coming up and down, up, hold for 10 seconds and repeat, or up and march. I'm gonna go for the march today, just because I feel like it. They're all actually really great to do on any level. If you're having trouble getting all the way up, even though that's the goal, do what you can. Okay, let's go. So I'm gonna come up, march. So people always ask me, do I need to contract my pelvic floor? Do I need to contract my belly muscles, my abdomen, anything like that? Definitely you don't want to hold your breath. That's why I'm talking right now, so I can breathe. But my answer is, I do sometimes have patients contract their pelvic floor to do the bridge, but that's usually only if they look a little wobbly to me, or if they're having trouble pushing up their weight. So again, they need a little bit more assistance for that task. But otherwise, I don't really have them contract anything. Sometimes I'll have them place a small ball in between their knees, but not for the marches, clearly. So if you feel like you're going up and you're really rocky, you might just gently engage your pelvic floor and then come on up. Otherwise, just do the exercise. Use your legs, use your back, use your glutes. That's what's going on here. But yeah, the core is working with the legs and everything else because you're keeping yourself up and not wobbly. Again, you can aim for about 10 of these or whatever feels right. I'm not a huge numbers person unless I'm working on endurance. I usually know, but oops, only one march. Anywhere from about 10 to 15 reps is great. Good, let's do a few more. Up and up, awesome. I'll do one more, up and up. Good, so again, the variations are just come up and down, come up, hold, or come up and do marches. All right, so the last set of exercises we're gonna do are for our abdominals today. We're gonna do a leg progression. So I'm gonna show you from easiest to hardest on this. I just chose 3 steps basically. You choose which one you want. When you do these, you're gonna have a small engagement of your abdominal muscles, or you can use your pelvic floor if that works for you. Whatever cue works for you best. If you have questions, just shoot me a question in the comments and we can work together to figure out which one is best for you. So you're gonna lay down similar to the bridge exercise, legs bent, okay? Your head's gonna look up towards the ceiling or a little bit more towards the horizon of the ceiling, I guess. The movements are gonna be from easiest single leg march, where you can do 10 or 20 of these, and you would alternate to the other one. The medium variation is alternating, or you could choose the hardest of all, which is a double leg coming up, okay? In any of these, you don't want your back to swing back and forth, okay? So you don't want to be away. You don't necessarily have to be flat. That's not necessarily the goal. You can have a neutral spine. I'm going to go for the double because that's my level, but you choose whatever is good for you, okay? Let's go. I'm going to gently engage and come on up and up and down. Awesome. I'm going to go for 15 of these. You go for whatever number works for you. If it's the hardest one, like I said, the alternating, you're going to do alternating 20, and the single one, you're going to do 10 if it's your first time, or you can move up to 20 per leg. Good. And make sure you're breathing. And if you need to re-engage in the middle, that's fine too. A couple more. I don't count, as you can tell. Good. If you need a little stretch afterwards, just bring your knees towards your chest. Awesome.